Welcome to another episode of Follow the Brand. I am your host, Grant McGaw, CEO of 5-Star BDM, a 5-star personal branding and business development company. I want to take you on a journey that takes another deep dive into the world of personal branding and business development using compelling personal stories, business conversations, and tips to improve your personal brand. By listening to the Follow the Brand podcast series, you will be able to differentiate yourself from the competition and allow you to build trust with prospective clients and employers. You never get a second chance to make a first impression. Make it one that will set you apart, build trust, and reflect who you are. Developing your 5-star personal brand is a great way to demonstrate your skills and knowledge. If you have any questions for me or my guests, please email me at grant.mcgaugh, spelled M-C-G-A-U-G-H, at 5-star BDM, B for brand, D for development, M for masters.com. Now let's begin with our next 5-star episode on Follow the Brand. Welcome to another exciting episode on the Follow the Brand podcast, your exclusive pass to the minds that mold industries and redefine the rules of the game. I am your host, Grant McGaugh, CEO of 5-Star BDM, where we help you to build a 5-star brand that people will follow. And it is my privilege to share the stories of the individuals who climbed their way to the top, bringing innovation, inspiration, and invaluable insight. Today, we're stepping into the world of healthcare with a leader who is bridging the technological divide between business and patient care. Our guest has journeyed from the heartland of St. Louis to the bustling healthcare hub of Broward Health in Florida. He has scaled the heights of academia, grappled with real-world healthcare challenges, navigated the rigors of military service, and now oversees one of the largest public health systems in the nation as CIO. Please welcome the new Chief Information Officer of Broward Health, the remarkable Steve Travers. From his humble beginnings to his present position of influence, we'll navigate through his multifaceted career, exploring the experiences and transitions that have etched his unique path. And as we move to the latter part of our conversation, we dive headfirst into Steve's pioneering approach to the intersecting world of IT and patient care. We explore his brush with disruptive technologies like AI and natural language processing, and his visionary role in revolutionizing healthcare IT. Steve takes us on an enlightening journey into the future of healthcare, a future not solely focused on disease treatment, but also on the power of preventive care. This engaging discussion promises to spark your curiosity and broaden your perspective on the transformative potential of technology and healthcare. So buckle up, listeners. You're about to embark on a riveting ride of knowledge, innovation, and change. You certainly don't want to miss this. This is the Follow the Brand podcast, where we are building a 5-star brand that you can follow. Hello, everyone, and welcome to the Follow Brand podcast. And this week, and I love every week I have interesting guests, but I don't always have a guest that's on that really mirrors my journey when it comes to my length of time in technology. And where he has a leg up is that not only has he had a very long tenure in technology, but a very equally long tenure in medical applications and technology and hospital systems. And we're going to talk to the brand new CIO of Broward Health. He's right here with me. Steve, would you like to introduce yourself?
Yeah, Steve Travers. I'm the new CIO out here at Broward Health, and I moved in from Mobile, Alabama, down here to Fort Lauderdale, and have spent probably the last 4 months down here. I've got an apartment here in town, and eventually my family's going to move down here as well as soon as my son graduates high school. But it's an exciting ride.
Well, this is, thank you again for being on the show. We met each other in person recently at the Transforming Healthcare and Cybersecurity dinner at Morton's. And I was surprised. He said, yeah, I just walked over. Like, wow. He said, yeah, just walked over. You just had, just moved down. I mean, very, very close. So it was very convenient. But it got a chance for me to meet with you and talk about some of the things in your background, which I find to be very, very interesting. So I want to start that. First of all, I know you've been in the South in Alabama for a long time. Is that where you're from?
A bit. I'm actually from St. Louis, Missouri was my original piece, but I moved down. My dad got a job in Mississippi, so I moved down to the Gulf Coast there when I was younger, and pretty much grew up in Mississippi and Alabama most of my life. And for a short period, we lived in Atlanta, Georgia, for about 5 years up there, and then mostly on the Gulf Coast there in Mobile, Alabama, and then another town called Pascagoula, Mississippi.
Wow, there you go. Right. So this is going to be a great conversation because it's look through your history. And first of all, you got to talk to me about, you got into the National Guard, and you also have a long history in academia and consultancy. Talk to us, walk us through the beginnings of your career path and what's your passion around this industry?
Okay, sure. So the military, I was graduating high school, and I was thinking about doing full-time Army. And, you're a young person, you've got so many things in front of you. And my dad had talked me into, he didn't want me to do the full-time Army, he wanted me to go to college. And so he had talked me into joining up with the National Guard instead of the other, and that if I went and I came back and decided that was the life for me, that I could stay and he would be fine with it, but to at least give it a try. And I'm glad he did, because I came back and went to college and started on my career. The National Guard was great. It helped pay for college a good bit for me, and it gave me a lot of discipline when I was young and needed that. And so it's been a pretty interesting ride. And then how I ended up in healthcare is that I was in Jackson, Mississippi, working on my MBA degree, and I needed a job because I was running out of money. And I found one with the local health system there. It's the Mississippi Medical Center. So they were looking for somebody to be a clinic manager. And I had applied, but definitely wasn't qualified for the position. But somehow or another, I got in with the department chairman for family medicine there at the university. And she interviewed me for that job and knew in the first 10 minutes that I was not a good candidate for it. But we got to talking about computers, and I was very interested in it most of my college years. I liked it. And so I talked myself into a job there at the Mississippi Medical Center to do system administration. And that was, she created the job for me, and it actually paid more than the clinic manager job did. And that's what got me on this road into healthcare IT, was that first break that I got from Dr. Mobley. And it was a fantastic experience.
Man, now we got another road in which we've traveled. And that's salesmanship, because you sold yourself.
Yeah.
Way back then. He said, I need money, I need a job, I'm going to school. You got something for me. So, and I know at that time, computers were brand new, and there wasn't a lot of people that had experience. You got into that. It's almost akin to now, where there's still a big shortage of cybersecurity, big shortage of the knowledge around AI. I mean, this industry is changing. But before we go into that discussion, I want to talk about, and I've seen this as almost a pattern when I look at senior leadership, lots of different CIOs and their path forward, is that they'll work at a provider for a while, then they go into consultancy. Talk to us about Did you always plan for that, or did you fall into that? Help us with that part of your story.
Yeah, I wish I had a good plan for myself in life, but I didn't. And so I got married. I married my wife there in Mississippi. She was a medical student there at the medical center, and we had met each other in undergraduate. But I ended up there because I was hoping that we could have more. And so we got married, and she was finishing medical school, and so she got accepted into Rome, Georgia for their residency program for family medicine. And so we were moving up to Atlanta. We were going to live right outside Atlanta. And I needed a job again and was looking. And a recruiter on one of the job sites got me connected with Ernst & Young up in Atlanta. And I interviewed for the position there. I didn't know what consultants really did. And they used some of the experience I had from the medical center. And I had an MBA at that time as well. So that kind of opened the door for me. And they hired me, and I loved it. It was great. I traveled and worked with several clients, both here in the U.S. and abroad. And so it was quite a learning journey for me. It really helped me with when you go from college into your first job, your quality of your work isn't as good as what it should be. And so for me, I had a lot of people that really gave me a lot of instant feedback on the quality of my work. And so it helped me become a lot better at what I do. And then as I rose up in the ranks in the consulting area, I moved away from being more technical to doing a lot of sales and management. So a lot of the work that we sold, you had to be one of the people selling it and preparing the materials and doing the presentations. And so that helped me with developing my skill set around selling ideas and getting people interested in things that we really thought would be beneficial to whatever organization we were talking to.
And so this is interesting because a lot of my audience, they're in healthcare. A lot of them are in information technology. A lot of them are in sales and marketing as well. And a lot of times you think about, all right, the CIO, he's like the most intelligent technical person. He knows all things IT. And you don't realize that in that position, correct me if I'm wrong, but that CIO position, a lot of times you help interpret a lot of these newer technologies and facets and innovations to either the board or the C-suite levels or the administration operations so they can understand the endeavor. Does that make sense?
It does. It does to a point. It's really taking a look at technology and being able to see that connection about how it works within the organization, and being able to take it away from. Often when I pitch an idea or I'm looking to do something, I don't talk about the technology. I talk more about the benefits and kind of seeing the future of if we adopted something, how that would impact physicians and nurses and the financial staff on various things, how that would impact them later if we were able to get that going, because that's really where the value of technology is. It's not in the artificial intelligence is really interesting and we all kind of like playing around with it, but seeing the future and what it can do for us is really the benefit. I did a project out at my previous employer at USA Health, and we implemented Nuance's Dragon ambient solution. And so it's a little device that runs on a program that runs on your phone, and physicians, when they're seeing patients at the clinic, basically turn it on. They talk about the patient that they're seeing. It listens in the background like Alexa does, basically, and sends all that data up into the cloud. And then they had some AI that was translating it, and then they converted it over and pulled out diagnoses and medications and things like that to where it could go into a note. And then they had a person look at it. And then once they approved it, it went right on into the EMR. So we had Cerner over there. And so it flew right into the EMR. And then the physician would come back, and just a little bit after they saw the next patient or two, they'd see the note And if it was acceptable, they just put it in there. So it was, for us, it was about how do we get the computer out of the physician's hands and get them back to laying hands on patients where they have conversations and discussions and do medicine again, and move them away from being these great documenters that we've been putting on them since, say, 2008, when we started doing a lot of the adoption of EMR. So it's really, how do we get the technology from being front and center to be more of the background, like the DAX system from Nuance, to where it's there, it provides a benefit, and but you don't really see it in action as much. And once we got that out there, pretty much every physician that we implemented on it, they would fight me if I ever looked at trying to take that back. It was such a great technology for them.
I love that. I love it because I've been hearing this over and over again for some years, actually, is that the EMR, because you have to document everything. So if you spend an hour with a patient, you spend 2 hours then trying to doing data entry. So how do you take a physician, make them a data entry clerk? And so that is not a good use of technology. And I'm so glad that you put that in perspective, because I always knew that you could automate some of this dictation. You just need to have it there, take it off your plate, and then make it available to you. So, man, that was the other big problem was adoption, is that the clinical world, they're almost tech averse, especially in the medical field, where they're looked upon as the laggards, they've been behind. And there's reasons for that. There's a lot of regulations in healthcare. There's a lot of things that you got to think through before you just throw it out there that you can't do in other industries. But you found a way for them to not only adopt it, but fall in love with it and can't live without it. How did you accomplish that?
Well, I think it's just looking at not worrying about the technology as much, but looking at if we applied a technology to a problem, which was, you were tethered to that computer for the longest time. And so if we could remove that in some shape, form, or fashion, that would be of benefit to the clinical side. And so Nuance just came along with a great solution. And these were I think it was the early days. That's what they had told me. But it was early on, and they were trying to get first adopters, and we signed right up for it. And I knew it was a competitive advantage for our health system compared to the others, because we were trying to recruit doctors. And one of the things that we started using as part of that recruitment was we were the only one in town that had the Nuance system and had that implemented. Everybody else had kind of ignored it, and we jumped on it. So they could buy it eventually later, but we were in the front for that. And so we were already looking at our next solution that we were going to bring to the clinical side that would make their life easier. And a lot of it's around AI, in thinking about how we could, if you don't use drag, because DAX worked well in the clinic setting, but it didn't do a whole lot for the inpatient side at the time. And so think about the NLP, AI type of stuff. NLP has been around for years. It was back in, what was that? It was 96 when I got my MBA, and I built an expert system as one of my projects for my class, and NLP was one of the things that we were looking at to do that, to use within the expert system. And so it was really interesting to get to see how technology from then that was in its infancy, I guess, or new, how it's made it into mainstream. And so today it's all over the place.
Very true. I've used NLP or got exposed to it through Nuance because I had a career at Avaya Technologies. It's pretty loose in AT&T. And we saw it in the voicemail world. We saw it in the contact center world, and its capabilities, especially when it got around natural language. That's what natural language processing. And it's on a whole nother level. It can actually duplicate a human voice. You can't tell the difference between the two, which is, we'll see where that goes. But this is interesting. I'm going to turn the conversation a little bit more toward you yourself, because I'm interested in the fact that you are leveraging a skill set. You've been leveraging that skill set ever since you got into the medical IT world, and you've grown with it. If you had to articulate that, like, wow, what makes you different? What are you doing? And I'm hearing a little bit about that. You are a pioneer. You go out and try new things. You'll innovate. How would you describe yourself as a CIO of today?
This episode is brought to you by 5-Star BDM. 5-Star BDM is a professional consulting and advisory group keenly focused on business development services for small to mid-sized businesses and entrepreneurs. Although every business is unique, they often share challenges that can be addressed through smart branding. Services include process improvement in operations, digital strategy and transformation, business intelligence, digital marketing, and personal branding. Our 5-Star business and personal branding company has helped a number of professionals and organizations to optimize and grow. The result is more business, more opportunities, better reach, positive outcomes. Please visit www.5starbdm.com to learn more and view all the episodes of Follow the Brand.
Yeah, I think I'm a bit different than a CIO who grew up in an IT department. So, I worked very little time. My first job at the medical center was with family medicine. It wasn't with the IT department. They were struggling at the time to get projects done by the IT department. So each of the different department chairmen were kind of creating their own shadow IT. So I was one of those shadow people that got brought in to really find solutions that were specific for that group. And so I really haven't spent a lot of time, other than some of the consulting that I've done, coming through IT. And so I didn't come in through desktop support and then make my way up into applications and infrastructure and all that. So I think I have a different perspective than somebody who has been doing this IT department type of thing for some time. And so I think I have a different perspective about where we really want to go. So I think less about what we're doing in the data center and what we're doing around new applications or standards. I think about how do we get rid of a lot of the standards and things that restrict us and look and come up with a solution that matches what the organization needs, much more than worrying about this is the way we've always done it in IT, or focusing in on a certain, when people say we're a Microsoft shop and we don't do Oracle or any of the other stuff. For me, it makes sense it makes sense that you want to try to stick with something as a standard, but it also makes sense that if the business needs something that is outside the standard, don't be inflexible and not do it or put barriers up for doing it. Look at how you can, as a fellow employee of the organization, how you can solve that problem with applying technology, or maybe it's an update for a process. And then I think I also look at really how do we integrate IT. You hear a lot about customers, that the health system's my customer. I don't prescribe to that. I prescribe to we're all employees of the organization. We all have a point in taking care of patients. And even though IT is not at the bedside with the physicians or the nurses, we are in a way, because the technology that they use to provide care these days is with the IT department. And so when we're here programming a workflow or setting up a flow sheet or something like that, we're just as important to the care as somebody who's right there in the room. It's a team event. And so getting the IT department to see us in that light, it really removes a lot of those barriers. And so you think of a hierarchy that comes from HR, where you have your org chart and you have all the positions and everything flows from the top down to the bottom, and everybody knows the decisions that they should make. And I think that's great for HR, but for IT, we have a network diagram where you have these interconnections, and it's the people who are more central in those networks, who have the most connections, who can bridge the gaps, are the most important people. in there. And so if you think about a network approach, think about LinkedIn and some of the other sites that really focus in on building that professional network. That's where we add a lot of value in IT. And that's where, when we look at where we're going, it's that person who can get involved, be a part of it, and see themselves not as an IT professional, but as a professional within a healthcare organization that's doing patient care every single day.
Love that perspective. Love that. Because that's really the mandate for a healthcare system. It's about the patient experience, patient outcome. We are in we call consumerization of healthcare now. I see right now that you get it, because if the person, everybody's going to touch healthcare at some point or another. And when they engage with the healthcare system, they're looking for a particular type of experience. And if everyone is involved with making sure, to the best of your ability, that patient has a successful outcome, man, that resonates. Because you're at your most vulnerable, when you're engaging with the healthcare system, and you're laying your life literally in your hands, and you definitely want to make sure that you are doing your best to make sure we get a positive outcome. I love that. I want you to talk to us a little bit about, because now you've been on both sides of the ball as far as being in consultancy, being in administration, and you're probably inundated with other people that want to get a piece of your time, that want to have you take a look at an opportunity to improve healthcare, patient outcomes with some type of technology, hardware, software, or services. What advice would you give to those who are standing outside your door trying to get a piece of your time?
I think it's connections, and it's kind of what you bring. I think I'm a bit different in that I like meeting with people that are consultants or have products that they're selling or whatever, because that's how I find out about the latest and the newest things. That's how I find out about things that can be applied in the organization. And so when you have folks that CIOs that tend to cut that off and limit or restrict access to them for providing information, you run into very much a tunnel type of vision. And so for me, I know when I was a consultant, I had a lot of great ideas that if somebody would listen to me and I could get the time, I could share that with them. But if they weren't interested in listening, there wasn't much I could do for them. So I try to keep open to where I meet with people, even if I can't meet with them for very long. But I do try to meet with them and discuss things with them and see what they've got. And then one day, down the road, they may have something that will totally change healthcare as we know it, and you're missing out on that great opportunity. It's the key is when we think about the IT department in an organization, it's broader than just the people that are employees. It's all of the vendors and the products and the consultants and the contractors. It's everybody. That's the part of the department. It's not just the employees by themselves. And so you've got to be open to listening to everybody. And a part of that is just making time for important things that you want to accomplish, and getting letting people have access to be able to speak with you and talk to you. And so we did the dinner where we had the presentation from the University of Miami on cybersecurity and all the great things. They're doing what was it? Wi-Fi in space. Isn't that fascinating? That's not.
Yes, it is.
I would have, if I would have just not gone and stayed and went on home, I would have missed out on that. So I try to make sure that we meet with people and hear those fresh ideas and those things, because I never made meetings with people that I didn't have something important to talk to them about. So and I haven't been to a meeting yet to where the person came in and didn't really have something of value, some type of nugget that I could take and keep there, because I may not be in the market for something today that you're selling, but I might be in the market for it later. I might get a new job somewhere else, and suddenly I need those things. So having that connection, that network, like that I was talking about with LinkedIn and all that, it's having that is what makes you valuable as a person in an organization. Is who can you call up when you need something?
Absolutely. And I know you've been calling up people at HIMSS. I was so happy that you are so a big part of HIMSS, that you've got some certifications in HIMSS as well. You're big in the Alabama chapter. We've got you signed up down in Florida. I'm the program chair for HIMSS here in South Florida. You're going to be part of a program we're going to have with ARM here in August. Talk to us a little bit about your HIMSS experience.
Yeah, HIMSS have been fantastic. I got into HIMSS when I was a staff consultant at Ernst & Young. So when I got that job in Atlanta, I found out about HIMSS. And initially for me, I joined up, and it was an area that gave me information about healthcare. Because my experience at that point was still rather limited. I'd only worked with the University of Mississippi Medical Center. And so I'd only seen a little bit of the world. And so HIMSS helped open up those doors for me as a young person. And, I went to a couple of conferences. I did for Accenture when I was with them. I was in their booth twice demonstrating stuff for healthcare. I think we had a physician's desktop that we created, which was kind of interesting, that we were trying to sell consulting work around. And then we had something else that we were doing with Nortel, with their Clarity system. I think it was called Clarity. It's been a while, but we did something with them, and so we were talking about that at the booth. So it really was a great place. And then when I started my own small little regional boutique consulting company, we did a lot with the local HIMSS. And then we did a booth in Orlando with my little company. We had one of those small booths that everybody walks by. That's there. And so we had a great experience. I brought some young individuals. We went to Universal Studios. They had never been in their life. And so we had a great time doing it. And then I think for them, all of those folks had just got out of college. And so for them, that was the start of their careers. And they got introduced to HIMSS and saw all the interesting technologies and what was there. And so it was a great thing for them to do. And then when I went to South Alabama, I had a friend that was a CIO that got me really working with the South Alabama chapter, and it was great. And so I got everybody on board with the university. We looked at doing papers and all that for the local HIMSS for presentations. We did a poster board. One of our students did that. So lots of cool stuff. And so in Florida, I'm looking forward to us doing that as well. Broward, from what I heard, was one of the first members of HIMSS here and hasn't participated in a while. So we're changing that. We want to be a big group inside of the HIMSS here in Florida, and to really make a difference with doing more around healthcare for everybody in the community. And that's what HIMSS does.
Yeah, and you're right. And we're thrilled, completely thrilled. So we've worked with a lot of the local hospital systems in South Florida and making it a more or less a mastermind group. That's what we're looking to do. So we can share good information that helps the community. And that's what we're looking to do. We do that through our integrated conferences. We do that at our golf events and different events. We're going to do an event here at Broward Health North really soon. I think it'll be in August. So we're going to go ahead and air this before that for sure. But we're going to have an opportunity to have some discussions, because here's what's happening. I want you to, this last question I have for you. As you think about the landscape and the ecosystem of healthcare systems and where they're kind of at the current state and what this future state is going to look like in the next 2, maybe 3, maybe 5 years, but they have to get there, and how this fee-for-service, value-based care, all this stuff is starting to really change how the delivery of healthcare is happening. I want to see what you're seeing from your viewpoint of the direction of health IT in the healthcare realm.
Yeah, I think we're definitely doing a ton around analytics. It's a lot of it is around. So value-based care has helped out with that quite a bit with your population health and trying to figure out how to, what's going on with different groups. But having information at the fingertips of our providers is really where I see analytics suddenly getting us into the realm to where we were focused so long on documentation. I think now that we have systems that are there, we're focusing more on how do we leverage that documentation. And so, if you look at Epic, for example, it has a predictive modeling system that's built into it. So when I go in and I see my doctor, they're able to see based on my risk factors, how likely I am to have high blood pressure or diabetes. It gives you a rating, a number for it. And then when you look at your health systems and the programs that they try to do to keep you healthy, they have registries to where they can see information about the people who would really benefit from a program around diabetes or whatever. And so I think as we move in, it's more about how do we have a healthier population and treat that as opposed to treating disease all the time, waiting for things to happen to people before we really get involved. And so analytics is a big thing. I think AI is going to do a ton for us in the future, specifically around getting rid of a lot of the day-to-day movement of data between different groups or whatever. So a lot of the data collection that's done that has to be manually copied and pasted or put into the chart, all that's going to be automated with AI. And then I think there's a lot of AI solutions that I've been hearing about that are looking at going through the information of the EMR and helping with identifying people that might have fallen through the cracks that are there. So you have somebody that's come in and they need a follow-up appointment and they didn't get that follow-up appointment. So how do you make sure that they get that in the future? And so a lot of those things that we're going to have is around analytics, AI, and works, the robotic automation type of things. It's really how do we get people away from using the technology and being data entry type of roles to using information and keeping people healthier and avoiding having somebody have their health go down before they have to come into the hospital to be treated with drugs and all the other things that make your life much more complicated. It's how can we be healthier? And so I think that's where we're really looking at going with IT, and that's going to be a great time to do a lot of these really cutting edge medicine pieces that we're not dealing just with disease, we're dealing with people's health and their future and helping them to live longer and better, more satisfactory lives because their health is there. You lose your health and suddenly things can really go bad. I had some back problems. And probably for about a year and a half of my life, I had back surgery and it was painful and all that. And so there's things, perhaps if I would have had better posture when I was sitting in front of all those computer systems, I might have avoided all of that. So, think about better health is something that could really impact a person's life.
I love that. The knowledge that we've already accumulated. I want to remind, especially my audience, that AI is just a collection of all of our human thoughts. It's not like some foreigner or some alien intelligence or something like that. It's just you're now able to get that information much quicker, just curate it much, much, much better. I do see what you're talking about is that, and I love how you frame that from documentation to now analytics and being able to utilize the information that we have more effectively and taking it away from, we're talking seconds it takes for someone to go into a coded situation, right? So the quicker that we can get information into the right hands, that can definitely affect outcomes. And that is wonderful. That's a great viewpoint.
Yeah, and I think you look at wearables today. I have an Apple Watch, and it keeps up with my heart rate. It keeps up with my sleep patterns, all that. I get up in the morning, I get a report telling me how well I slept. If I woke up during the night, if your heart is part of heart health. If you exercise, you can reduce your heart. I forget. It's basically it works a lot easier, so it's not pumping as much. And so at night while you're sleeping, if you have that, I seem to have a better sleep with that. And so I was able to see if I would try not to eat before I go to sleep and I get exercise that evening for a walk, my heart worked a lot better during the night, and I actually woke up more rested. I wouldn't have known that if I didn't have the data that's coming off of a little watch and a simple little bitty iPhone telling me all of that. That's where we're going.
Yeah.
It's fascinating.
I love it, man. This is going to be a great. Well, I'm going to do this, and probably somebody else has told you this, but I'm going to say I'm going to welcome you officially to South Florida and the South Florida healthcare community. We're glad that you're here. We're glad what you're bringing to us as an experience, and you've been just a stellar human being in what you've been doing for the last 30 years. And I am so glad that you are a part of our community and what you can bring to us as far as change in health IT.
Awesome. Well, thank you for that welcome. And I've enjoyed meeting you and being on the program. And I look forward to us working together on HIMSS and some of the other things that are gonna happen. But it's, we're in some fantastic times in history. And this is a time to make a big difference. And so I love coming to work every single day, and I love the things that I do. And a big part of that is helping others and building the careers of young people that are starting out and helping them, just like all the people that helped me out when I was younger in my career and opened up doors that I wasn't even aware existed at the time.
And that's what we need. We've got to prepare our next generation of people to have opportunities to gain the experience. Because like you were saying in the beginning of this entire podcast, that you didn't just start out with, I'm going to be a senior health IT executive.
Yeah.
It just kind of morphed and changed. Somebody gave you that opportunity. And then your skill set starts to really get in. You start to see where your strengths are, your opportunities, and then you improve yourself to get above some of the weaknesses that you have to arrive at these levels. This is fantastic.
Yeah. It's I had no idea where I was going in life. My first major that I was in, I was at a junior college because I didn't do well on my ACT. I was at a junior college, and I signed up for international business. And the lady who was my French teacher was also my counselor, and I was flunking. I had probably an F- in French, and she told me when it was towards the end of the year, and I was signing up for my next classes, that if I would drop out of the international business program and change my major, that she would give me a C in the course so that I could do it. And I took that C, and that was probably the best advice that I had received as a young person in college, was really focusing in on what is it that you want to do in life. It took me a long time to figure it out, but it was that she could have flunked me in that class, and I could have had that might have been something that really pushed me down the wrong path in life. But she took the time out and did that for me and gave me the advice I needed to hear to get going. And there's probably a dozen other examples that I can talk about. That job that I got at the medical center, they could have just said, you're not a good fit for it. She went out, the director, she went out and created a new position for me and hired me for it. That's, people help people out all the time, and we all get breaks. And it's a great thing to pass that on to somebody else, because you've either received one or you're going to receive one in the future. You should help other people out as well. I love doing things like that.
I love to hear things like that and do things like that. It's people helping people. That's why we're here. I love that. You got to have a little grace in this life. There's no doubt about it. So if people want to contact you, is LinkedIn the best way?
Yeah, LinkedIn's good. I keep up with that, and I pretty much, a lot of people have my email that's here. So it's just stravers@browardhealth.org. So feel free to reach out to me. I'll be more than happy to talk to you. We are looking for, everybody's looking for people and talent for their positions and that. So we are looking for a lot of new folks to join our organization. It's a great one to be a part of, and Broward Health is on the move with some really great initiatives.
This is fantastic. I could definitely reach into my network, let them know what opportunities are available so they can get in touch with Broward Health. and let's make the community better. That's what it's all about. I want to see a healthier community, put some smiles on our faces. We've all been through different things, especially through the COVID era, and it's time for something a little bit more positive to take root. So thank you for putting down roots here in South Florida.
Oh, it's exciting. Thank you very much.
You're welcome. Your entire audience can tune into all the episodes at Follow Brand at 5-Star BDM. That's B for brand, D for development, Masters.com. This has been wonderful, and I'll see you very soon. Take care.